Okay. Good evening, everyone. Welcome to another section. Nice to have you wonderful people in the room. I'm going to introduce the presenter for today. Is one of our research assistants, Jatia, and she will be doing the presentation on some very important topic. Welcome, everyone. So Jatia, over to you.
Okay, hi everybody. I'm glad that you guys were able to make it out tonight. So I have just two different topics that I'm gonna brush over really quickly, information that I found. So let's get right into it. The title of this is Turning Up the Heat, and that's because of the most recent increase in heat advisories we've been having in the weather. It's really important that you stay knowing how to be safe in the increasing heat. So, you know, some people, if they don't have AC, if they don't have fans, then it's good to have this knowledge. So, according to the NCEI's Global Annual Temperature Rankings Outlook, it is virtually certain that 2022 will rank among the 10 warmest years on record. So, I'm not sure if you guys have been paying attention to the weather alerts that have been going on in the last couple of years, but global warming is a real thing, and climate change, you know, is happening in this generation. So it's important to be aware of the different changes that are happening in our climate and how to stay safe throughout. Go to the next one. So, like I said before, today's topic is heat health. And what that basically means is what you can do to stay safe and how you can help others. And also some of the risk factors that might put you at an increased risk for being inadvertently affected by the increased heat. So I'm going to go to the next. Okay, so heat and heart disease. One of the topics that I did find that is a link to people who might be more at risk to being harmed at extreme temperatures are people who have pre-existing conditions. So someone who has diabetes, someone who's struggling with heart disease. If the weather increases too much, they're more likely to get into a more emergency situation. So what was that? Oh, if you have questions, you can feel free to ask. Just, you know, raise your hand or let me know. I can answer them as best I can. No questions? All right, so then I'll go on to the next slide. Okay, so heart disease is one of the leading preventable factors of disease in the United States. The Heart Association of Doctors here said that cardiovascular disease accounted for approximately 19.05 million global deaths in 2020. So that's globally, but you also in the United States, heart disease is one of the leading factors of death and hospitalization. I'll go to the next slide. And why that matters is because in extreme temperatures, people with chronic conditions, like I mentioned before, diabetes, hypertension, and heart disease are at a higher increase to being in emergency situations in higher heat temperatures. So like it says here, heart problems, heart conditions, it's important to know how to keep yourself cool and protect yourself when the temperatures rise. Okay, so how do we protect ourselves and keep ourselves cool when the temperatures rise? There are a couple of different things that you can do. One of them is find a place that has air conditioning if you're getting too hot in your home. Public places like libraries, banks, even the mall are good places to go when you just need to find a place where you can cool down a bit. You can also monitor weather forecasts for heat advisories. If it's too hot, if it's getting way too hot, it's no reason for you to be standing outside, especially during the hottest times of the day, which is 12 to 2 p.m. Those are the times that you want to be in the shade, or you want to be inside, or someplace where it's not so much direct heat and sunlight. The second way is to, when you're outside, make sure you're drinking plenty of water. Our bodies are 85% water. We're mostly made of water. So it's important that we keep that replenished. When it's hot, your body tends to sweat and it's working to pump all the blood through your body. And it drinks up that water very quickly. So sometimes you don't even notice it, that you're thirsty, but drinking 8 ounces frequently, especially when the temperature is very high, can keep your body functioning the way it needs to, keep you cool. Any questions?
Right. This
or comments? Okay. So I'll keep going. Oh, one more thing I want to say about the water, especially someone with pre-existing conditions like diabetes. Sometimes those also come with symptoms like poor circulation. So if you're not drinking enough water, you can have your body can retain the sweat, and you can build up. I'm losing my words here. I'm going to move on to the next slide. But drinking water is important, especially when it's a very, very hot outside. That's the point I wanted to make. Okay, another way to protect yourself in the heat is to avoid soda and fruit juice and limit alcohol. So, I mean, if it's summertime, I'm sure some of you, you enjoy a nice drink every now and again, but alcohol is dehydrating. It makes you very, very thirsty. It can, make you slow and not really pay attention because you might, the effects of the alcohol. Soda has a lot of sugar in it, and sugar is another thing that dehydrates you. It makes you even more thirsty, even though you're drinking and drinking and drinking. If the beverage that you're taking in has a lot of sugar, you're really not getting much of the not nutrition, what's the word? Hydration that you need. So avoiding sodas, fruit juices with a lot of sugar in it, and alcohol can really help you to retain the water that you might be drinking more of in the heat, and keep your body at a nice cool temperature so that you can continue, regular functioning and not have bad side effects like headaches or, sun dizziness or stuff like that. You also want to protect your skin. I know that sometimes in our community, we feel like, brown skin does not need sunscreen, but that's not true. Brown people can get sun damage just as badly as white people can, or any, non-person of color. Our skin, even though we do have a little bit more protection because of the melanin, it's still skin. So if it's not protected, it can get burned. You can have under skin damage or layer damage because we have several layers of skin. So it's important to wear sunscreen when you're directly in the sun outside. You want to wear a wide brimmed hat or sunglasses to protect your eyes, and loose clothing so that you can allow a breeze to go through and you're not sweating and making yourself overheated in the heat. Doctors recommend 30 SPF or higher. So you can just look for that. Most people use physical sunscreens, but I find that with brown skin, if you use a chemical sunscreen, it doesn't show up as white on your skin. So you could look into that as well. Going on to the next one. Also, if I'm going too fast or anybody has questions or comments, let me know because I'm kind of flying through this. All right, and so the last thing I wanted to talk about when it comes to heat health is how to detect signs of serious heat illness. So sometimes you might be standing outside for a long amount of time, maybe a barbecue, or you're having a good time, and you don't really notice, or you don't really notice the effects that the sun is having on you. If you go to the beach, sometimes this happens. So here are some of the effects. If you're feeling extra hot, or your skin is extra dry, or you're feeling cold or clammy, these are effects of possible heat illness. You might need to step out of the sun for a few minutes, or maybe take a cold drink. If you're feeling confused, or you're not really all there at the time, you're feeling disoriented, that's another sign of heat illness. You might want to go into the shade or take a seat. If somebody is fainting, because I've seen that happen before as well, somebody's on the beach, they're out there for too long, you can faint or lose consciousness. And that is actually very dangerous because the person, it might be difficult to revive them back. You might need to call an ambulance for that person. I actually did not include the steps to in emergency situations if somebody is unconscious, but that can be looked up. The last thing is if you're feeling nauseous or vomiting, this is a serious sign, another serious sign. The last two signs are very serious of heat illness. And so you might want to let that person go inside or go someplace that's more cool, give them a drink of water, something like that. Okay, so before I go on to topic 2, I just want to recap what I said about topic 1, which is that it's very important to stay safe in the sun and in the heat. If you have pre-existing conditions like diabetes or heart disease or hypertension, it's doubly as important for you to be aware of your surroundings and of your body, making sure you're drinking enough water and staying in the shade and being aware of the temperature's effects on you. And that's that for heat advisory and health. Thank you. And this is the second topic that I wanted to touch on. I'm sure you guys all know how to brush your teeth, but it doesn't hurt to cover basics. So we're talking about that today. So I don't know if you guys recognize this character, but he's from the Fairly Odd Parents. And he is Chip Skylark. He sings about having shiny teeth. It's very funny. It's a great topic. But he has amazing teeth. And so we want to be like him. Next. So basically the basic steps of brushing your teeth is recommended by the Dental Association that you use your toothbrush at a 45-degree angle, not directly on your teeth or directly on your gums, because that can cause abrasions. Second step is to move the brush back and forth gently in short strokes. Some people tend to brush their teeth very aggressively because they feel like it makes it more clean, but that's actually not the case. In fact, if you're brushing your teeth too aggressively, you can what do you call it? You not erode, but you can bother some of the enamel, and the enamel
that you could damage your gums. Isn't that what you want to say?
Thank you very much, Sister Rosie. Yes, you can damage your gums or you can damage the enamel that's on your teeth, and you want to keep the enamel because that's what, one, that's what keeps your teeth looking white and pearly. And two, that's what protects your inner teeth from getting too sensitive or from getting exposed to like the foods that we eat, sugars, and being maybe more susceptible to cavities. So gently in short strokes and at a 45-degree angle is the best way. And just because you're brushing hard doesn't mean you're making it more clean. Okay, so I'm gonna go to the next slide. Okay, then you want to clean the inside surfaces of the front teeth. For this, you want to tilt the toothbrush vertically, which means that it would be facing kind of downward while the top of the toothbrush is facing up underneath the back of your teeth. And then you want to, after that, doing that all around your mouth, you want to go brush the tongue to remove all the bacteria and keep the breath fresh. So some people forget the tongue, because they think, oh, I'm brushing my teeth, I don't really need to get my tongue. But it's important because what happens if you don't brush the tongue, bacteria can build up there, and that can cause sore throats. That can cause room for bacteria to grow, and that bacteria can get into your gums. It's very bad. So it's important to brush your teeth, but also brush your gums, brush your tongue, brush your cheeks even, and even under the gum line. Next slide. Okay, and the reason why that's so important is because brushing the teeth in this manner helps to prevent tooth decay. And so some symptoms you might want to look out for when it comes to tooth decay is if you're seeing a brown spot on your teeth that is just not coming off, it's not a piece of garlic from lunchtime, that might be an early symptom of tooth decay. If your teeth are bothering you all the time and it's not your wisdom teeth, but like your front teeth or your side teeth, if they're hurting, that might be an indication of tooth decay. If you're experiencing any sort of pain while biting or chewing, or when you're drinking something cold or sweet, tooth sensitivity is a very common thing, and that doesn't always mean tooth decay, but it's important to talk to your dentist about it, because that also can be a symptom or a sign of the beginnings of your tooth or your enamel eroding. So it's important to make sure you go to your dentist and you ask about that if you're feeling any of these symptoms. Okay, and I meant to warn you guys about this slide. It's very graphic, so I'm sorry in advance for those of you with more weak stomachs. But these are just pictures of what tooth decay might look like in mouths and on teeth. On the left-hand side, that's plaque buildup, and in between, you can see some of the brown spots, the black spots that are showing up. And then on the right side, upper right, you can see the inner side crevices of the tooth because they were not flossed or brushed properly for a long time. There was buildup there, and that bacteria was able to deteriorate the tooth in that manner. And then at the bottom is just a cartoon version of what that deterioration would look like on the inside of the tooth. So some of the things that lead to this could be if you're consuming food or drinks that are high in sugar or starch. So that doesn't always necessarily mean candy. Sometimes it could be foods like tomato sauce, or if you're eating a lot of rice and pasta, that's starch and that actually has sugar in it. So you have to make sure that you're brushing properly to get rid of all of that from your teeth. If you're having a lot of snacks in between your meals, it's important to have 3 meals a day and snacks in between, but if you're having a whole lot of snacks like Cheetos and carbohydrates and sugary drinks and things like that, that can also lead to the beginnings of tooth decay because you're not able to brush your teeth that frequently. So those things just sit there in your mouth, and it's able to adhere to the teeth, and then it's more difficult to get it off when you do brush your teeth, which usually is about twice a day. Some people brush 3 times a day, but I don't know anyone who can brush 5 times a day, which is normally how often I eat in a day. So if you don't brush your teeth or floss regularly, flossing is just as important as brushing. And if you have a dry mouth or are older than age 65, sometimes even if you're doing everything that's right, sometimes just as you get older, things deteriorate. I don't think it would get to this point, but it's important to be aware of that and recognize that you might have to work twice as hard in order to keep away the things like tooth decay or decaying or deterioration of the enamel if you're over 65. Okay, and these are just some quick facts about toothbrushing and teeth. It's recommended by the American Dental Association that we brush for 2 minutes, 2 times per day. This is the best way that we know so far to remove plaque, buildup, bacteria, and any leftover food that we might have had from eating. Also, you want to make sure that you're replacing your toothbrush every 3 to 4 months. Your toothbrush can build up bacteria as well. And if you're brushing your teeth with the same toothbrush, you're reintroducing that same bacteria that you just cleaned off back into your mouth the next day. So all of the old bacteria from your lunch last week, if you still have the same toothbrush and you didn't wash it out, you're just putting it back in your mouth. So you have to make sure that you're switching out your toothbrush every 3 to 4 months. Sometimes you can do it sooner than that, and rinsing out your toothbrush when you're done brushing your teeth each time. And the last thing, I know a lot of people, there are different camps on this. Some people say electronic is much better. Some people say hand is much better. But the American Dental Association says both are equally effective in cleaning teeth. So if you have an electric spin brush, or if you have, your regular Dollar Tree brush, both can easily clean your teeth very well. And that is the last of the slides. Thank you so much, you guys.
Wow, that was excellent. Let's give JT a round of applause. Wow. Wow. And she didn't know she was presenting, even though she did the slides. She didn't know she was presenting. I just threw it on her just a minute before we went live. So great job, great job. Always ready. Beautiful, beautiful, excellent work. I know you have a PowerPoint. It's not a PowerPoint, a video that you want to show. I'm going to see if I can bring it up. Let me see if I can bring it up for you. Give me a minute. I'm gonna share it now. Let's see if it's gonna come up. No, it's not coming up. YouTube video. Do you have the video, Andy? Jatia? Okay, there it, I see it. Okay, I'll show it. Okay. It's just like a video representation of all that she said.
To keep your mouth healthy, it's so important to brush your teeth for 2 minutes twice a day. Here's how to do it right. Place a soft bristled brush at a 45-degree angle to your gums and move the brush back and forth in short strokes. Not too hard, use gentle pressure, not hurting the gums. Brush all sides, including the chewing surfaces of all teeth. To clean the inside surface of your front teeth, tilt the brush vertically and make several up and down strokes. And finally, brush your tongue to remove bacteria and keep your breath fresh. Use a fluoride toothpaste with the ADA seal and replace your brush every 3 to 4 months. Sooner if the bristles get frayed. Brush twice a day, floss once a day, and see your dentist regularly. To learn more about taking care of your teeth and gums, visit mouthhealthy.org.
Okay, give me a minute. Let me close that up. Hold on.
I offer free samples to look cool on the app.
Okay, great, excellent. So one other thing I want to say that actually made me to even think of the topic about brushing your teeth was I was having a conversation with my girls, and somebody mentioned about the importance of, even when you use a fluoride toothpaste or whatever toothpaste you use, to actually not rinse it out after you use it. I never heard of that. I don't know if anyone here have heard of that before, but they showed me a couple of clips, and the two of them said, yes, I discovered that. You have to leave the fluoride toothpaste in for it to actually help you. And it occurred to me, like, every time we brush the teeth with this nice toothpaste and we rinse everything out. So from what I gathered, you have to leave that toothpaste in after you brush your teeth. Of course, you want to rinse your mouth before. When you do that last application, you want to leave that in and not rinse it out. I was like, that makes sense. Did anybody hear that before? Anyone has heard of that before?
Yes.
You did, Sunday? How come you never told me?
Just leaving you.
Oh, yeah.
I didn't hear what you said. Somebody called me on the other phone. What was it?
Oh, I said that after you brush your teeth with your toothpaste, you're not supposed to rinse the last toothpaste application out, because that toothpaste has to be in your mouth to actually protect the teeth.
Oh, I think I hear that, but I don't like that, because if you're going to eat anything, it just tastes so bad with that toothpaste in your mouth.
Yeah, I understand that. Yeah, but it's...
No, a school of thought says that you should just let it stay in there for a while. Then maybe later, after a few minutes, you can rinse it out.
Okay.
Right. Yeah. Okay.
When you really think of it, you have to stay for it to work. Because most of the time when I brush my teeth, I don't know what you guys do. From when I was born, I just rinse everything out right away, and I apply my mouthwash afterwards. But it's actually supposed to be the reverse. It's supposed to maybe rinse your mouth with water first, apply mouthwash, then brush your teeth, but leave the toothpaste in. Dr. Cody, what do you think about that? Did you hear about that before?
Well, you should either do that or use mouthwash and let the mouthwash stay in your mouth, because most mouthwash now have, additives to them, fluoride and such like that as well. So either way.
Okay, so if you have a mouthwash that has fluoride in it, okay.
I don't like mouthwash.
Okay, so what I'm gonna give everybody homework. The homework is let's do a research on this and come back next week. I can see the look on Sister Rose's face. Do a research on it and come back next week, and let's see what we find out. But it was really interesting when I discovered that. I was like, that's something. Okay, so Dr. Cody, right back to you. Oh, any comment, question? Jetia, you did an excellent job with that presentation, that research, putting together that PowerPoint and even presenting it. Thank you, thank you. So any question, comment regarding that? And I think there's some.
I do have one comment though regarding
Okay, go ahead.
heat and diabetes. So the thing is that if your blood sugar is high, you can experience polydipsia, which means increased thirst. So you might be confusing increased thirst because it's hot versus increased thirst because your blood sugar is elevated. So you have to be very careful in distinguishing between the two, because if you drink too much water, then you can end up with hyponatremia, which is, which is not a good thing to have. So, so you have to be really careful if you have diabetes to make sure that you're not drinking water because it's hot versus drinking water, a lot of water, because your blood sugar is elevated. So that I would, just make that point.
Yeah, thank you. Thank you so much, Dr. Coney. And
I
I
have a
think one of the
question.
other way, all that thought, I think one of the other way you can also distinguish beside that, between that and regular thirst is if it's like excessive and if it goes with, you're still urinating a lot and then you're constantly hungry even though you're eating. So that's some of the signs that will come together. So if you're really, really drinking a lot and you have the issue of diabetes, you want to check it out. And sometimes it might even come up, maybe you've not even been diagnosed. You just want to be sensitive to your body and look at and see if there are things that feels different. And then you may want to question it. Because for me, when I discovered that I was borderline diabetic, I just felt like my body was funny. It wasn't feeling regular. I woke up in the morning, I'm like, why did I feel funny this morning? And it wasn't even like with the water thing, but I was just not feeling myself. Because I know I have a family history of diabetes, the first thing I did was I said, you know what, let me check my blood sugar. And it was in the morning and I checked it because I have the glucometer at home and it was maybe like 130 something. I'm like, that's a little bit high. It's not high, but it's a little bit high for after when I haven't eaten before breakfast. So, and then I was able to call my doctor and said, okay, the blood work I did last week, can you add hemoglobin A1C so we can check, So little things like that, because if you don't have a doctor that is really proactive, they might miss it. Like initially when you start with a new doctor, they might say, okay, we'll do all the blood work, but then they may not follow it every year, so just make sure at interval, if you have family history of diabetes or your body is feeling funny, you can request, for your doctor to check your hemoglobin A1C. So at least you know where your numbers are. I think that's really important, to check at intervals. And somebody has a question. Okay, Sister Rosie was trying to talk. Rosie, go ahead.
Yeah, I just wanted to ask, I'm a recovered cancer patient from many, many years ago. And I kept reading up and they used to say about the fluoride that there's such a thing as taking too much. Now, my 3 grandkids, they have these big bottles of fluoride rinse and stuff like that. Is there any question about that? They're young, that maybe later on in life that's going to affect them because it's added fluoride. Do you know anything about that? Maybe not.
Well, it's a rinse. Are they swallowing it? Are they ingesting it, or is just a rinse?
Well, it's a rinse, but a 4-year-old, 3-year-old.
Okay, Dr. Coney, you want to chime into that? I would say I don't think it will affect them if it's just a rinse and they're not ingesting it. Dr. Coney or Sunday can.
I'm sorry, I was trying to unmute and getting a text at the same time. There is such a thing as too much fluoride. But I would discuss that with your dentist, especially since they're young children. They should be seeing the dentist, and the dentist can make a recommendation at their age as to how much fluoride they should be exposed to.
Thank you.
Okay, so Yeah, because there is a risk of having too much fluoride. But like in anything with children, especially, things have to be dose adjusted, you know, for their size, their body weight, etc. So I would discuss that with the dentist.
So Dr. Cooney, just for my clarity, so even with fluoride for mouse rings, it has to be adjusted. Are you talking about what they ingesting? Or I know when you take it in your mouth, it still can go in a
Right,
little.
it goes through your gums, but
Okay.
I would consult with the pediatric dentist because she's talking about a 4-year-old and stuff like that.
Mhm.
So I would, I would discuss that with the pediatric dentist as to how much they should be taking, what they should be doing, at that age. So
Okay.
because, one size doesn't fit all, and especially when it comes to children and their development and things like that. So that's something that I would take up with the dentist, because fluoride can affect the bones. Too much fluoride, and children are developing and they're growing, and bone growth and stuff like that. So I wouldn't want to mess with their skeleton. I would just make sure I discuss with the dentist, because I wouldn't want to damage their bones, and their joints. So I would take that up with the dentist.
Okay. Okay, so that
Thank
question
you.
was in the chat. It has been answered. Okay, so that question was in the chat and it has been answered. So any other comment or questions? Comment, questions? Okay, great. So so Dr. Coon, you want to give an overview of the updates? I know you attended the meeting today.
Yeah. So at this point, finally after weeks, it seems like that we've reached the peak of this latest wave. I think this was the 5th wave of COVID. And so now we are down to a medium level. That is not a low level. So it means that there's still transmission in the community at a medium level. In terms of vaccinations and things, the federal government has not reapproved COVID funding. So everything stops on June 30th. So the pink and green and yellow, orangey buses that you see out there will cease operation June 30th, which is Thursday. So you will not see that anymore unless Congress, decides to reallocate funding and things can get up and running again. The other thing is that, of course, everybody's heard on the news that the vaccine is now approved for children 6 months and older. So the recommendation right now is for the children to go to their pediatrician to receive the vaccination. There are few public sites where you can receive the vaccination. There's a list. We can send out the link for that later on. There are no sites in Far Rockaway, notably. So right now, the strong recommendation is that you take your child to your pediatrician and treat the vaccine as part of their routine vaccination protocol. So those are the 2 highlights from today. Everything shut down because Congress. So that's it.
Okay.
I have a question.
Go ahead.
My sister, she is vaccinated 2 doses and was about to get her booster. And she going out, I think she said she went out because she was staying by me here. And then she got COVID. And what I want to know is what treatment they give you after you're vaccinated twice, and then you get COVID. What do they do for you when you go to the hospital?
So she can go to a CVS Minute Clinic and request Paxlovid, which is medication pills that you take 3 pills twice a day for COVID, but you have to do that within the first 5 days of getting COVID. So that's an option, or she can go to, local hospital. That's an option, or a city hospital. And, also there are monoclonal antibodies, etc. But she can go to her physician and request those things as well, or at least contact her physician and see what she's eligible to get.
All right. So what happened? She really lived in New Jersey, and she came here, but she had to go back and forth to do some business. So when she was here 2 days, I let her take a test, and it was negative. So then she came back and she continued going and coming. And then the Thursday, she was saying her body hurting her. And like I have a headache. So when I got up Friday morning, I said, listen to me, you take another test. And when she took it, she was positive. So I told her, go to St. John Hospital, but she went right away. And when she reached there and she called me, she said, they said there's nothing they could do for her. So they tell her go home and whatever, the word. So she said that she cannot come back here because I'm living in a studio apartment. I'm older than she is. I'm not vaccinated. So she says she told them she cannot come back here. So they kept her in the hospital, not in the hospital, in the emergency. They asked her questions and things, and then I tell her, well, when they say they cannot do anything for her, I say call 311. And then they say, okay, they'll get somebody to talk with her about it and things. So she stayed there, and then they sent her up in a ward where they didn't give her anything again. And then they warded her. And she said they gave her, because she had headache, fever, coughing, pains, and beside that, she has a kidney problem. And beside that, she got injured on her job. So she have another physical problem with this pain in her head and neck. So they gave them, I forget what she said she asked them for, and they gave her 1 dose or something, but it didn't do much. So they keep her there so they tell her they can only keep her there for 5 days in St. John's. So when the 5 days was up, they tell her, well, she have to leave. They can't do anything for her. Good. So they gave her a letter and tell her to go to some place in the Bronx. Now she's positive COVID, feeling sick, whatever, and she had fever too. But she had to leave St. John Hospital and go and travel on the train to go to the Bronx. When she reached there, they sent her to a Marriott hotel on 11th Street. I don't know if it's in New York. And there she went, but still no kind of treatment, nothing.
Excuse me, Sister Blackman, you said that they gave her something while she was at St. John's. It's possible that they could have given her IV monoclonal antibodies.
They gave her something to drink.
Well, I don't know. You know
what it is. She tell me what it is, but think.
So,
anyway,
that's Sister Blackman. Is this the same sister we discussed 2 weeks ago? The same one that we had, or this another person?
Say it again.
Is it the same sister we discussed 2 weeks ago?
Yes,
Or is it
yes,
another
yes.
person?
Yes.
Because I know we had this conversation before. I just want to make
Yeah.
sure maybe
So
something.
so what she's saying, so they sent her to this place in a hotel, a Marriott hotel. Now she's there on quarantine. She cannot leave, she cannot go, she have to stay there. So all they giving her again with all the fever, and the cough was terrible. So at least when the cough was all the time, but one nurse, the morning nurse, gave her honey and lemon. Good. It didn't make no difference. And then the evening nurse say, how you coughing? So she gave her something for the cough. She said eased up a little bit, but she was so weak and she still have, still positive. She's supposed to stay 10 days there.
Well,
So,
Sister Blackman, this is a very personal issue, and I don't think that we can really discuss it because we're not privy to her medical records and all of that information like that. So I don't really think it's fair for us to discuss that on this platform.
The main thing, I'm discussing that, but the main question is, do they give you medication for COVID? That's my question. She's twice vaccinated and she's due for a booster. So my question
you can still get medication if you're vaccinated. Yes, you can. So like Dr. Crony said, we're not there. We don't know the plan of care.
I know, but
you did indicate that they gave her tablets. We're not sure what it is, but if you're vaccinated and you can still get the medication, the Plavovix. So you can still get.
That's what I want to know, if she could get medication, because they didn't give her any. So that's what I'm thinking.
Mr. Blackman, you just said they gave her something.
They got once. So today now it's 15 days and she's still there in the thing. So it's just I wanted to know if they wouldn't give her more.
Because when they outside of the hospital and they're like in the hotel, so the hotel is not a hospital. The hotel, what they do basically at the initial stages, they just check their vital sign to see how doing. If they get worse, then they send them back to the hospital. So that hotel is not like a healthcare center where they give them medication and all those things.
But then at 10, she have two nurses that come, one in the morning, one in the evening. So all I want the question is just if they give medication for it. That's my question, honestly.
Okay, I think we answered that. Did we answer that for you?
Once, yes, but I thought it would have been more.
Well, we don't know what happened there, but what we can say, normally they give medication. They can give you medication if you're vaccinated. You can still get medication. You can still get all the treatments.
All right. Thank you.
Okay. You're welcome. Any other question, comment? Okay, I see everybody is good. Dr. Coney, you have closing thoughts? Dr. Sunday, closing thoughts before we let the people go for the night?
No, I'm good.
Okay. Sunday?
I'm good.
Okay. It's Monday night. Everybody's like good. I'm ready to go back to bed or stay in bed. Okay, have a good night, everyone. Thank you for joining us on this platform again. Tomorrow, we have Niabule, so please come back and join, and I'll put the link to join for Niabule. I think you guys are going to get it from me anyway. I'll put it on the chat so you can join us where we're going to discuss about parenting, seasoned parents, really connecting with maybe young parents. So come, there's always something for us. Invite your husband or your brothers to come. We want to hear from the male too. Okay, have a good night, everyone.
Yeah, have a blessed night, everybody.
Good night, everybody.
Thank you, Mr. Beverly. Thank you, everyone, for your participation.
Thank
you.
Bye, Naomi. Have fun tomorrow.
Okay.
I know you're working at the polling. Have fun.
Okay.
Hi, Miss Sabrina. How are you?
Hey, I miss you. How you doing?
I'm fine.
Good. I'm glad you are.
Thank you so much for your prayers. Okay, bye everyone. Have a good night. Oh, sorry.
Good night,
Good night, everybody.
Good night.